You're watching the news for South Mississippi. This is the 4 o'clock show.
Well, sniffles and sneezes are an inevitable part of growing up, but if your child has a lingering runny nose and cough around the same time each year, it could be seasonal allergies. Joining us now with more on how to spot the signs and ways to alleviate some of the symptoms, Dr. Jerson Cadenas, Chief Medical Officer of United Healthcare of Mississippi. Thanks so much for joining us here. Okay, so we're talking about allergies. We can see the pollen out in the air and piling up, so it would be normal to have allergies this time of year. What are those signals to look out for?
Yeah, thanks for having me, You know, seasonal allergies, also known as seasonal allergic rhinitis, have the same signs in kids that they do in adults, like itchy, stuffy, or runny nose, or it could be red, itchy, or watery eyes. You can also have itching all over your skin. The more common signs are sneezing and coughing, and in some cases, people develop increased fatigue as well.
So it can be confusing, though, because there's a lot of illness going around, too. There's flu going around, as well as some other things. So how do you, or what's some telltale signs that it's a virus compared to allergies?
So typically, allergic reaction does not develop severe symptoms like high-grade fever or significant shortness of breath. So when that happens, it's very important to consult your doctor to determine the immediate cause of this of these symptoms.
Okay, so a fever would be different probably from allergies. There to something to look out for. So when do you think that people should go to the doctor, especially with their children, if they're showing signs of allergies and then having problems with it?
Correct. Yeah. So if a patient develops a significant high-grade fever, or if a symptom develop like swelling in your lips or your tongue or anything in your mouth that causes significant shortness of breath, that is a trigger for you to seek immediate consultation.
So what are some treatments? What are some simple ways that people can treat some of these symptoms?
Yeah. So there are several options, right? The first one is preventing or minimizing exposure. So if you don't need to step outside, staying indoors with the windows closed is very important. Now, if you need to go outside, an individual may need to wear an N95 mask to prevent, pollen exposure. Now, there are several over-the-counter medications that we can use. Number one is antihistamine, and you can also use nasal corticosteroid sprays. And also, we can use decongestants. So these are usually used for short-term use. Some other remedies could be a nasal saline spray could also be used to prevent further minimizing the symptoms of allergic reaction.
And we were just on the screen seeing some of those tips that you can do to prevent allergies. But as far as how severe is this allergy season are you seeing compared to previous years? Is there a way to know just how bad the allergy season is this year?
Yeah, so it depends, right? From a lot of times it depends on where you live. It also depends on which plants or what trigger is causing this particular reaction. Like allergies from trees typically occur in springtime, and then allergies from grasses could actually happen during late spring up to early summer, and allergies from weeds can occur late summer to through early fall.
Okay, well, thanks so much for joining us. So many people deal with allergies. It's just kind of part of life, but you gave us some good tips there to mitigate it.
Thank you so much, You.
The